I'm just going to do a quick pump demonstration. This pump that we have here is a Sigma Spectrum pump. It's typically what we're using in Calgary area hospitals and in fact most of Alberta hospitals now. So I'm just going to show you how to use this pump. We have our client here has already had an IV insertion, medication administration, and this client may need a different medication that needs to be on a pump, or we're going to administer fluids to this patient through an IV line at a given or a set rate. So what we're going to do quickly is we have our pump. We make sure our pump is off. It should be plugged into the wall. They do run on batteries, but just to make sure that it has enough battery, make sure that it is plugged in when you go to use it. In our line, we have one of these little blue keys that tells us that it is used in this pump. So we take our blue key, which is in my hand. We're going to insert it into the pump at the top. There's a little spot there that the key fits right into, and then it's going to open our pump. Now we can see that the power is coming up here, and it tells you actually quite systematically how to use this pump. So we've loaded the set. It's telling us to load our line into guide 2, which as you can see is right here, guide 2. And you push it in. Now it wants us to load our line into guides 3 and 4, which are down here. So use your thumb to push them in, and then you can close the door. Now you open up your roller clamp, and then the pump will prompt you. So this is a new patient, so we're going to select yes. And it asks you where you're using this pump, and typically we're only using them in adult L&D, so this is pre-selected for us. So we hit OK. And then it'll ask you type the first 2 letters of the drug name that you're administering. So for penicillin, it would be PE. For oxytocin, it would be OX. For IV fluid, it's a bit confusing. People always have this question, but you are going to be, no matter what your IV fluid is, so here in this case we have lactated ringers, and you're just going to type in for IV fluid, IV. So it's like the old T9 text, if anybody is that old, IV. And then it'll give you a screen where you get to select which IV fluid you're using. So we're administering Ringer's lactate, so that's what we will select. And we'll say that we want to give this to our patient, our client, at a rate of 125 mils per hour. So then we would select the rate, which is 125. VTBI stands for volume to be infused. We have a 1 liter bag, so I usually select 999. Assuming that we've used 1 mil of fluid to prime the line. And you hit OK to confirm the volume to be infused. And have a look at what you set it at. The rate is 125, your volume to be infused is 999, and it calculates how long this will take. So it's telling us what to do. We're going to push run to start it, or hold to stand by. So we're going to run. We need to make sure that we have our clamps are all open. I'm opening the roller clamp, and we hit run. It'll ask you if all the clamps are open. They are. The tubing is not kinked. The drops are flowing in our drop chamber, you can see, and so then you can select yes on your pump. And it'll tell you now we're infusing Ringer's lactate at 125 mils per hour. And to stop that, you just push stop, and it says pump is stopped. So you can program your pump to do IV fluid or any medication. We do typically use them to administer fluids and for oxytocin administration in an augmentation or an induction of labor. And in the case of oxytocin administration, very important that you program your pump correctly, but that you also have a double check from a charge nurse or a registered nurse or another midwife, depending on what your unit policy is. So, and that's it.